Welcome to Season 2 of Boundless, where we give voice to Good Shepherd Rehabilitation's patients and their families. Our guests share the remarkable stories of how they triumph over illness, injury, and disability through the arduous but life-changing process of rehabilitation. My guest today is not only a dog lover, but a semi-retired veterinarian, Christy Shoup, who worked as a vet for 20 years in Maryland until a stroke changed things. Christy, it's great to have you. Welcome to the show.
Thank you for having me.
Yeah. So tell me a little bit about your life as a veterinarian and before, you had the strokes.
Mm-hmm. Yeah, I worked a lot. It was, my passion, also my job, kind of the dream that I had since I was a little kid. Mm-hmm. And so I had my own business for a while, filling in at different veterinary hospitals, and then most recently found kind of my home hospital where I was very happy.
Was that in Maryland?
It was, yeah. Yep.
Uh-huh. And you actually were born and raised in Berks County.
Correct, yes.
And then went to Cornell for veterinary school?
For veterinary school,
yeah,
yes.
A great school.
Yes.
And I think you went to Moravian at one point.
For undergraduate,
Undergraduate,
yep.
yeah. Mm-hmm. So you have a connection to the Lehigh Valley already.
Definitely, yeah.
So tell me about, everyone loves dogs, and we have our cat people too, and maybe all those pocket pets, everyone even loves those as well. What was it like being a veterinarian and being so involved in your profession? Like you say, it was also a passion.
Yeah, it was my hobby as well. So I trained service dogs. I ran a therapy dog program for a number of years. So it was kind of my, my job, and then my passion and my after hours activities as well.
Right. And so tell me about you had a stroke.
I did.
And tell me about the onset of that. And you actually were aware of what those symptoms
Luckily,
meant. Yeah.
Yes.
Tell us about that.
I had my ex-boyfriend, his father was in the hospital, and we were going to visit a lot. It was, end of life for several weeks. And so we were visiting, and every day they had the acronym, the FAST, which is like, face, arms, speech, time, posted up on the elevator doors. So we would look at that every day as we were up and down the elevator multiple times. So
right, these were indicators of stroke.
Yes, so I was very much aware of what the signs were. And I actually ended up with COVID. This is before vaccines were available. And so...
What year was this?
This was 2020. It
was
right November.
In the heart of the pandemic.
Mm-hmm. Yes, it was right before Thanksgiving, a couple days before. Mm-hmm. And I was waiting for test results to determine whether or not I'd be able to go back to work or not. And, in those days, it took several days to get the test results. So I was kind of waiting up in the middle of the night watching Hallmark movies, which is like a guilty pleasure, and noticed that as I was kind of fidgeting around that one of my hands felt numb or like didn't even feel like my hand. It felt like I was holding someone else's hand. And so I was, concerned. I thought I would try to make some, motions with that hand, try to do like a little finger gun, and that wasn't happening.
Right.
And I knew immediately that I was having a stroke.
Wow.
So
because so many people don't. They don't recognize those symptoms.
I was lucky that I was awake for it.
Right. Yeah, this could all be happening in your sleep.
Right.
And so what action did you take? You knew you had to do something.
Yes. So I immediately put both my dogs in their crates, so get them secure, and then called 911 and got the door unlocked.
Wow. And how quickly did they get there?
Very quickly. I was actually able to walk out and get in the ambulance myself. So I was in pretty good shape when they got there.
Right.
By the time I got to the hospital, then I had pretty much lost my whole left side.
Wow. And how much time was in the interim there?
I was probably living just a few miles from the hospital, so it was very quick.
That quickly?
Mm-hmm.
Wow.
Yeah.
And so by the time you got to the hospital, what were the symptoms?
I, at that point, had like a little bit of feeling still in my left leg. I had nothing in my left arm from the shoulder down. No feeling, no motion, nothing. when I got into the ambulance, I heard him, when the EMT was calling it in, talking about, my face being, asymmetrical. And I was like, oh, crap, I have like the melted face thing.
Oh,
So there was that. And then, as things progressed, then I gradually lost almost everything in my left leg as well.
wow.
So a little bit of sensation, but I could not stand without assistance, could not walk.
Right. It really makes you appreciate EMTs and emergency room.
Oh, yeah. And the ICU nurses were incredible.
Wow.
So.
Right. All very important. Again, time.
Yes, yeah.
And so how long were you in the hospital, and then what ensued after that?
So I was in the hospital for 10 days,
Mhm.
several days in ICU while they're kind of getting things figured out, and then just kind of spending time in a room till we figured out kind of what next steps were. And because I was down in Maryland, I was at an inpatient rehab down in Baltimore, which is Good Samaritan, and was there for 3 weeks,
Wow.
relearning to walk.
Mm. What were your feelings at the time? I mean, you're...
I was devastated.
Yeah, of course.
I mean, without my hand, I can't work. So,
Right.
I was doing surgery and lots of, other things, dental care, everything that required 2 hands.
Right.
So,
We really don't understand, just how lucky we are to have all our faculties.
right. Yep.
Until we don't have them.
100%, yes.
Yeah. And so you're probably wondering, what am I going to do now? I mean, you're
Yes.
how old now? You're
46 at
46
the
at
time.
the
Panicking.
time.
Yeah.
Yeah, because
Yeah.
you have a whole, career to go, right?
Yeah, and the neurologists that I talked to down there were not very encouraging about recovery for my hand at all.
Really?
So, and they basically told me that, 6 months from then, whatever I had then, I could consider my new normal.
Oh, wow. So
So-
they're saying you have a ceiling. That's
Yes.
it. Nothing
Yep.
beyond
At 6
that.
months, that's, you can still improve a little bit, but 6 months is kind of your basic. So 6 months after my stroke, I had a real meltdown because I thought this is it for me.
Right.
But that's like where Good Shepherd came in. Because
Right.
I moved back up to Pennsylvania to live with my
Mhm.
parents for assistance.
Right.
And then they were very emphatic that was not my limit.
That your parents were?
No,
Or
Good
the-
Shepherd.
Oh, the good chat.
Yeah, my parents didn't know one way or the other.
Yeah, your parents are just, doing whatever they can to
Yes,
support you.
absolutely. They're fantastic. but
Yeah, that's great that, I often wonder what people do who have no one.
yeah, that's.
So.
I know I'm very lucky
Yeah.
in a lot of ways.
Mm-hmm. And so that must be, it's an interesting question because you're, although you deal with, animals,
Hmm.
that fine line between being straight with a patient,
Hmm.
in the case of an animal,
Right.
the owners,
Yes.
and yet being compassionate,
Yes.
and being, encouraging. Where is that fine line between not being
Yeah.
realistic and being hopeful?
Hmm. The therapists there were actually a lot more hopeful than the doctors were. So, it's a
That's
good
interesting.
learning experience
Yeah.
for me, just from the other side.
Right. And I think maybe in those cases where therapists are on the front lines,
Mhm.
they're actually dealing with people. They see the differences that can be made, where the
Yes.
doctors, it might all be theoretical in a way.
They're
I
a
don't
little bit
know.
removed, I think.
Yeah, a little bit
from it.
removed. Yeah.
But I was spending hours a day with with my therapists.
Right. What kind now, after the stroke and all the ramifications of
Mhm.
that, uh, what was your condition? What couldn't you do that you used to be able to do?
So, I mean, eventually I was able to walk. And, now I'm able to walk without any devices or assistance.
Yeah,
But
at
I do
first,
have a
what
lot of
did you need?
chronic pain. So that's been something I've been dealing
Oh,
with.
chronic pain.
Mhm.
But what did you need initially? Did you need a cane, a wheelchair?
Initially, I was in a wheelchair.
Okay.
The first time I went into Good Shepherd, I came in a wheelchair. Yep.
And so many stories like that. Going in the
Yes.
wheelchair and after rehabilitation,
Yes.
you're walking.
Yes.
You're out of the wheelchair.
Hmm.
Uh,
So it kind of went from wheelchair to a walker to a cane to eventually, no assistance.
right. Yeah. And each one is kind of a milestone.
Hmm.
And like if you were in despair, you might stop at the cane, you might stop at the walker. But you have people who are encouraging you on, the
Mhm.
therapists that you had
Yes.
at Good Shepherd,
Yes.
and get it. So you can get there. You made it to from the wheelchair
Mhm.
chair to the cane,
Yes.
which is a great,
Yes.
like a leap,
Mhm.
right?
Yes.
But don't stop there. You can keep going. And you're
Yes.
living proof that that's true.
Yeah. They're like a really inspirational bunch. So
And meanwhile, you have your dogs. Were they helpful too? I mean, like therapy
in a
dogs. Or,
way.
I know it must have been harder to take care of
Well,
them.
I was training service dogs before
Ah,
before my stroke. So the one that I had with me at the time, who was about halfway through training, went on to become a breeding dog for the program that she was in, and now retired and came back to me.
ah.
So I kind of have my own little service dog, but I think she's pretty content to be a couch potato right now.
I think she
Yes.
probably deserves it at this
Yes.
point.
Yes.
She's entitled.
Yes.
Take a break, right?
Yeah.
Um, and so, what kind of therapies did you go through at Good Shepherd? What were some of the physical therapies that you
Hmm.
did? Can you
Like in what?
what do they do to get you to the point where you can get up and
I mean, it's a lot of strengthening
right
exercises,
muscle
working on
muscles?
balance.
Hmm.
Balance is a big one.
Right.
Um, and I also had to learn not to move too quickly
Hmm.
because I didn't realize, I never thought I would be described as somebody who moved quickly. But like just kind of taking my time and learning to do things correctly.
Right. And did those therapies restore some of the sensations in your
So
legs and your hands?
I have very little, I think, deficit in my left leg now. There's some weakness.
Right. And
Um,
do you attribute that to the physical therapy?
my recovery?
Yeah,
Oh, 100%.
100%.
Yes.
Right.
Yes. The harder part has been kind of my arm and my hand
Hmm.
on the left side.
Right. And now you're dealing with the chronic pain issues
Yes. Yes.
that come along, and they can be pretty challenging too.
Yeah.
So.
But again, that's I actually came from physical therapy right before I came here.
Uh-huh.
And I have some fantastic therapists there, which I'm sure people, realize that with Good Shepherd. But my therapist that I had today, Troy, was working on getting like all the knots out of my back and everything. So I'm now at this moment not painful at all. Where I
Wow.
walked in there, I was probably like a 4 to 5 out of 10.
Right.
Now I'm comfortable.
It's
So,
interesting, all of the different things
yes.
that they can help you with.
Yeah, a lot of strengthening exercises.
Right.
But they're really good at changing up what we're doing based on how I feel that day.
Right. So you might think, well, it's just
Mhm.
restoring the ability to walk or get up,
Yes.
but it's also
There's so
pain
many,
issues and
little fun.
balance issues
Hmm.
and all those other things
Yes.
that are kind of interrelated.
Hmm.
And so you were talking about the therapists.
Yes.
And how important is it to have a strong connection, a human connection with your therapist?
I think it's critical.
Hmm.
And I feel like the therapists that I see now have become friends. I mean, I've been at Good Shepherd now for 4 years.
Hmm.
So they've seen a lot of changes with me, and some of them they all bring their own unique experiences. So there's even a lot of things, I think, just generally about life that I'm learning from them as well, not just physical skills.
Right, right. It's amazing how it extends way beyond what you might think.
Yeah, and every therapist brings their own kind of special,
Talent.
yeah,
Yeah.
like a talent or motivational factor.
Right, right. That's kind of their personal mojo, like what
Yes,
they bring.
it is. It definitely is.
Hmm.
Catherine is really good at finding that one motivational piece at the end. So I
Uh-huh.
always end every session on a success
Right.
to kind of carry me through. So they all have their own special
Special
kind of skill.
technique
Yeah.
based on their personality, their skills, their insights, their knowledge,
And
all of that
I've
comes
gotten to
together.
work with a lot of different therapists, and in the beginning that was scary for me to work with, with somebody different, but now I really welcome being able to work with all the different therapists and seeing what I can come away from that with.
Right. And even as a veterinarian,
Hmm.
I guess, the same thing applies. Like your therapists know you,
Hmm.
they know you well.
Yes.
And they can almost
Probably too well.
anticipate too well. But even in your own profession,
Hmm.
when an owner brings their, golden retriever to
Hmm.
you, and you know that animal because they're
Yes.
regular patients.
Right.
It's a regular, and so you form a connection with the owners and the
Mhm.
animal too, I guess.
Yeah.
And that makes a big difference. Other than like, well, I just know you from a sheet of paper in my
Mhm.
files.
Yeah.
I know you for real because I've checked you out and I know the kinds of things to look for
Yes.
and to think about
Yes.
before you even, as you walk through the door.
Right. And you kind of that way pick up things like what is different this time.
Right.
If you know what is the normal.
Exactly. So, how many years how long has it been since you've been in therapy, Good Ship?
It's been a little over 4 years.
Oh, 4 years.
Mhm.
Okay. And so, looking back at the timeline now from the beginning to
Mhm.
now, what is your life like now, post,
Um,
uh, you know,
right.
rehab?
So very different because I'm a lot more independent than I was before. I was relying on family for everything, not able to get dressed by myself, the really basic things.
Right. And for someone who is in a profession like your own,
Mhm.
who, is always the one delivering the care,
Yeah.
that's not easy because
No.
now you're on the receiving and you feel like you should be giving out the care and not receiving it.
Right.
So you have to accept that.
I was also very independent.
Right.
I lived by myself for, the last
Mhm.
20 years, kind of taking care of everything.
Right. Right.
So
And so now what's your life like now? What are you doing? What are your
still
activities?
still living with my parents.
Uh-huh.
Just economically right now that makes a lot of
Right.
sense. And there are still some things that I need assistance with, but it's a lot less. Um, but they also my dogs have become their dogs, I think more. And so
Of
my dad
course.
is the dog walker, um,
Right.
the feeder of dogs. So they've they've kind of settled in there. I
Right.
think if when I go, I'm not sure that the dogs will want to go with me.
Yeah, now they've
But
bonded with,
yes,
the
yes,
whole pack
mm-hmm,
includes your
yes,
parents as
yes,
well.
yes.
So, but you now are actually providing some telehealth
I
for
am.
for pet owners.
Yes, yes. So I do some behavior consults and new puppy and kitten consultations for
That's
owners.
great.
So I do that a couple times a week or sort of
Right.
as needed. Some medical problems, but less so.
Right. But things that can be done that way
Yes,
and done effectively.
surprisingly, a lot of things can actually be done through telehealth
Hmm.
if you've got good technicians to rely on. So if the animal needs to go into the clinic, I can do
Right.
that long distance.
Uh-huh. Can you write them prescriptions
I
if they
can.
need
Hmm.
medications
Yeah,
and stuff?
as long as they have an existing relationship with the hospital, we can do a lot through telehealth.
Wow, that's
So
great. Well, you have come a long way, and as I say to so many of the people who come on this show, and they walk in and
mm,
they tell me about their stories of being in a wheelchair or being prohibited from
mhm,
doing this and that and the other thing, and now they're independent and
mhm,
freewheeling, and if I didn't know their stories, I would never guess in a million years that
right.
they even ever
Yeah,
had an issue.
and I'm not done yet.
No,
So
and you're still going? Are
still,
you
yeah,
still going to rehab
I
or?
am. Yep.
Okay,
I actually had a surgery done um, in November to have an implant put in called Vivistim, and that is helping to help my brain form new connections to do the things that I'm not yet able to do.
that is amazing.
So I'm the first one to have that to go through the rehab at Good Shepherd. So their guinea pig. Um,
How does that work? Is there a clicker of some
so I
kind that
actually
triggers it?
when we do the therapy there,
Right.
they do have like a clicker, and so they're able to, as I do something, as I like reach forward, and I'm making a conscious movement, they'll do the click
Right.
to release these neurotransmitters to help my brain form new pathways be able to learn to do those activities.
Right. So, like, what kind of practical thing would you do that this would help?
So the things that were my goals when I started with Vivistim
Uh-huh.
are not the things that I got better at, but your goals have to shift, with what's improving.
Right.
So I was actually wanting to work a lot on fine motor skills with my hand to try
Right.
to get back to
There
work.
you go. Of course.
But what I ended up gaining is a lot of arm strength and movement. They do a particular evaluation I think it's called like the Fugelmeyer or something like it's got a funny name.
Mm-hmm.
But the maximum score you can get on that is a 66. My pre-Vivistim score was a 36, and my after 6 weeks of the intensive therapy they do was a 61.
Wow.
So I made a
Almost
lot
perfect.
of improvements.
Yeah,
Yeah.
that's fantastic. And it's kind of like training your brain
It is, yes.
to then activate
Mhm.
this, appendage or
Yes,
whatever,
yeah.
and get it back in form. The more you do it,
It helped me to actually kind of remember that I even have another arm. It's kind of like if you had a third arm, when you went to do things, you would do them just your regular way.
right.
You wouldn't be like, oh, I can use the third arm for this because you're just not used to it. And it's kind of that way when you're down to one. It just doesn't occur to you to use it for a lot of things.
Right. It really does exemplify the immense complexity of the brain
Yeah.
and how much we're learning about it
Mhm.
every single day.
Yes.
So,
Yes. So,
that's amazing. Well,
yeah.
I am so thrilled to have you on the show.
Well,
And,
thank you.
you're an inspiration, as so many of our guests are. Through your journey, others may also, feel the
I hope
courage
so.
to face the
Yes.
the hurdles that are
Mhm.
in front of them.
Yeah.
So
I think just having a good attitude is helpful with all that.
the attitude is what pushes you through to get to
Yes.
where you need to be.
Yes, for
And
sure.
it looks like you're there.
Thank you.
And there's more to come, right?
Yes, absolutely.
Well, Christy, thanks so much for sharing your story and what it took to go from a wheelchair to no wheelchair
Mhm.
and beyond and more independence. It was a pleasure to have you on the show.
Thank you so much for having me. I really appreciate it.
You're welcome. Thank you. And that's it for us. Check in with us next time for another episode of Boundless and more personal stories of perseverance, health, and wellness from Good Shepherd Rehabilitation. I'm Grover Silcox. Thanks for tuning in. Stay well.